Hi everyone, it's TMJ Kim again, and it's been 3.5 months since I've taken out my splint and I haven't had it in. Actually I'm doing this update because I just saw my surgeon 2 days ago, for a follow-up. It's been 2.5 to 3 years since my surgery. And my teeth are starting to look beautiful again. They're going back to their original position before I had orthodontic work as a child. Bad orthodontic work, that is. And they're starting to come together. And, I got some good news. My teeth are moving really slowly, which is kind of bad, but the good news is they are moving. So as long as they keep moving, I won't have to get any crowns or any partials or anything to make my bite just right. I am chewing, but with caution. I'm not biting anything, like biting into a taco or a hamburger. I'm not eating anything like chips, although I know I mentioned in a previous video that I was going to eat a bag of chips, and before I took my splint out, I did eat a bag of chips, or a little bag of chips, and I enjoyed that before I took it out. There was a time where I was just taking over-the-counter pain medicine, which was nice, but my neck has started acting up, and I don't know if it just gets really knotty, like a naughty. And I figured out ways to help with that, but anyway, I've been doing really well in school. I'm going for my Master of Fine Arts in Architectural History, and the first semester I took a full course load. However, with the neck pain, I wasn't able to take a full course load this past semester, but I've gotten it figured out now, so that's good. With a combination of ballet, which is great, which I've gotten really good at, I think, for the amount of time I've been doing it. And so that really helps with my posture. It's almost like physical therapy. And then also I used racket balls to I lay down and I get the knots out of my trapezius area, and between my shoulder blade and my spine. That's where the trigger points really are. And you can really feel it loosening up all the way through here. At first, my teeth came together really fast. So if you're at the point where you've taken your splint out and they're coming together really fast, they may slow down, but don't let that discourage you. And also, I guess it was good news, Another thing that was brought up is, and I've always known this ever since, I believe 6th grade is when I had braces, 6th and 7th grade, and everything was fine, and unfortunately, I went to not such a good orthodontist, that's to put it lightly. I was able to explain to my surgeon what was done. They changed my bite, and not through any surgery, but through a little retainer in the top of my mouth. It wasn't a retainer, but it was something in the top of my mouth, and which moved my bottom jaw forward out of its natural position. So that's what caused all of this, and it really is sad because, I can't go back, but, you know, I wish I could, but I can't, and I've had to go through hell, and it's all because of, somebody's just not educated enough, and they don't know what they're doing, and they are treating children, and it's terrible. Fortunately, this person isn't in practice anymore, but there still are people. So, for all the parents watching this, or to-be parents, make sure if your child is getting orthodontic treatment, check with a qualified surgeon who has an MD and a DMD or a DDS. Make sure they're a dentist and a doctor, and make sure that the orthodontist is doing what, make sure it's not just cosmetic and it's going to ruin their life or part of their life. I just can't say enough about it, and there's quite a few class action lawsuits going on that I've heard about, through YouTube and everything, of orthodontic work, and they're trying to scam people, and it's just awful. And they're trying to make people sign papers that say, like that orthodontic work can't cause TMJ problems, which is totally untrue. I'm living proof of that, and so are the other millions of sufferers. But anyway, I also addressed the fact that I've been getting a little worried that everything's going to happen all over again, that my jaw's going to start hurting again, and everything's going to just go all over again. Of course, anyone would have those fears. But my surgeon said it's been 2.5 years, and that's highly unlikely unless I just injure my jaw again randomly. Also, if you're looking for activities to do after your surgery that aren't so pounding, such as running on concrete or something, ballet is really good. You can actually just look on YouTube and do ballet. At the bar, of course, in flat shoes. Climbing is good. Rock wall climbing. Anything like that. Just walking is good too. Make sure you have good posture. And another thing, which was an issue to begin with, was, you remember me talking about my orthotic, and I look back at the videos, I listened to them with my new really nice headphones, my Bose headphones, which I'm so happy to finally get. And I'm telling you, I'm really proud of myself, and I'm proud of my surgeon for making such a great orthotic that I didn't have to talk funny in, because that's just, this day and age, that shouldn't even be on the table, having to talk weird because of something in your mouth. So also for all the neuromuscular dentists out there, if your orthotics are causing your patients to talk funny, that's unacceptable. Also, since I am studying to be an historian, and I've had to make some speeches, I've been worried about projecting my voice. Well, first of all, I'm soft-spoken, but second of all, my jaw can only handle a certain amount of talking. And I was able to make both of my speeches and get really good grades on them. And I was able to project my voice a lot louder than a lot better than I thought. And it's probably from, ballet, holding, your shoulders down and back. to get that good projection. But you know, and also as a historian, I'm really glad, and I watched all my videos before I'm filming this, and it's good that I've documented it, because I see how far I've come, what I've had to go through, and just how ridiculous things were. And things seem really good right now. So it is good to document the process. It's not for everyone, but you know, I never thought that I would do a blog or a vlog, or anything, but I'm glad I have. And I don't know, I hope I just continue to get better, my teeth come together. There's no reason why they shouldn't, that I can think of, so. Except for the fact that my jaw was put out of place when I was a child. So, for all you just starting this journey, it's gonna be hard, but you'll get through it. I feel sure. And if you need to talk to anyone, as always, you can email me at tmjdkim@gmail.com. You can Facebook message me at TM Joint Venture. I have a group. It's an open group. Also, I have a blog, tmjointventure.blogspot.com, where these videos are. You can also send me a message on YouTube. There's a million ways to get in touch with me, and also if you want to email me, usually I'll give out information like my phone number, or you know, if you need help, or if you need someone to talk to, because if you don't know anybody who understands, you can, yeah, I'm willing to talk to anyone, no matter what time of day it is. So anyway, with that, thank you for watching, as always, and I will probably post another video really soon. Okay, thank you, and have a great day.